In 2018, in the midterms, Democrats believe that they recaptured the House by virtue of the debate over health care. There are parts of that discussion that are probably not getting the same attention as maybe just the idea of Medicare for all. But for example, 43 million Americans living in poverty, and the numbers are not diminishing. And one example of a trend toward criminalizing ownership of the use of e-cigarettes and other vaping products, which actually exacerbates the problem of poverty in this country. That's the take of our next guest. Scott Ballin is a health policy consultant, former chair of the Coalition on Smoking and Health, and joining us here on POTUS. Scott, welcome. Thank you for being here.
Yes, good morning. How are you?
I'm fine. So the e-cigarettes, Juul obviously is one of the manufacturers. There's been a concern that they are just addicting people, and as a result of that, even if their intent was to try to help people quit smoking, yours is an economic argument, not so much about the health, but rather the economic argument. Make it for us.
Well, I think it's both health and economics because you can't separate the two. You have to realize that there are well over 30 million smokers in this country, and they are costing society a lot of money in health care, lost health productivity, $300 billion a year. And yet, a lot of the smoking that is going on is occurring in the lower social economic communities, and we're not doing enough to focus on that. And these are the people who are getting sick. They don't have health care. They don't get the medical attention they need, and they're the ones that are addicted to the deadly combustible products in the form of cigarettes. And we've had a lot of attention focused on Juul, as you mentioned. Which is fine, and the concerns about youth uptake of tobacco and nicotine products, but we should not be ignoring those 30 million people out there who are addicted, particularly in these low-income communities. And my personal view is that we need to give them alternative products that they can use to get themselves off deadly cigarettes and help save money for not only for themselves and the communities, but also for the country.
This sounds like an argument about where the addiction manifests itself. In other words, it's almost like saying, well, we'll use methadone instead of heroin. And in this case, it's nicotine instead of, as you call them, combustible cigarettes.
Yeah, it's the form of delivery of the nicotine that's the real problem. People forget that the patches and gums that are already out there, many of them flavored, have nicotine that is derived from the tobacco. So people have gotten into this mode of thinking that nicotine's the cause of the cancer and the heart disease and the strokes, and it is not. And, we need to get some balance put back into the discussions on what the regulatory framework should look like so that we can regulate these products based on their risk. Deadly cigarettes are clearly, without question, the problem in this country that's been killing people for decades. And now we have new technologies being developed, non-combustible products that are being developed, science-based products that could actually help the spectrum of the population, including these communities where smoking has been excessively high and costing people a lot of money. But we're not doing enough to educate them about these issues or giving them access to those products. There's a product called snus, which is non-combustible form of tobacco that, it's a little pouch you put in your mouth and you get your nicotine. It's flavored, and no one seems to be complaining about that. But this whole issue of flavors and e-cigarettes has just gotten out of hand with the discussions. The FDA needs to take a careful look at what it's doing. They made an announcement in July of 2017 that was very focused on working to do both ensuring that youth don't use cigarettes and tobacco products, but also at the same time helping tobacco users, the smokers, get off the deadly habit. We haven't seen very much action on that second one, and that's where, there are, as I said, 30 million people. Yes, we're reducing the use of deadly cigarettes in this country, but we can eliminate smoking in this country if we give people lower cost, consumer acceptable alternatives.
Again, Scott Ballin with us. He is a health policy consultant. People are going to ask the question, are you working for anybody, by the way, in this? Do you have a dog in this hunt?
No, I don't, and that's been one of the things that I decided not to do. I've done some consulting to the Food and Drug Law Institute in Washington that tries to bring people together to sit down and talk through these issues. as well as the University of Virginia's Institute for Negotiation that has also, over the years, brought parties together who normally disagree with each other to find common ground. So I think that what we need to be doing is bringing the stakeholders and players together to discuss some of these important issues. There, in my personal view, because I do not work for anybody, there is a lot of common ground to be found and a lot that we can do to reduce the disease and death caused by tobacco products in this country, and we're not doing enough of that.
Who needs to have jurisdiction over this? In other words, which federal agency should have oversight? And this seems to be one of the, it was a constant issue with cigarettes, and one wonders if it's something that belongs in a particular department.
Well, the FDA should have. I've always taken the position that all the various products from combustible products, non-combustible products, and even to medicinal products like the patches and gums, should be in one agency so that we can have a better understanding of the risks and relative risks of those products on society, and allow claims to be made and people to get information that will allow them to make more informed choices about those products. We're not doing that very well. I mean, I still talk to people, as I said earlier, who think that it's the nicotine that's killing everybody, and it's not. FDA had said that they would begin a campaign to educate people about the role of nicotine, and they haven't done it. They focus too much on the youth issue and the whole issue of child brains being affected by nicotine, and that's an important issue. But in terms of adults being able to get a cleaner form of nicotine, a safer form of nicotine via non-combustible products, we need to be doing that. And we need to be doing it now. We've been waiting and waiting for decades to allow this to happen. And until there's some more leadership and a recognition on the part of even my colleagues in the public health community to sort out these distinctions, instead of making this a media circus, which it has become, we're going to see the same old stuff, history repeating itself.
In the context of the political discussion, both in terms of the 2020 campaign and what is ongoing on Capitol Hill and in Washington, D.C., is there a sense that somehow addiction management, whether it's nicotine or whatever, patches and so on, should that be part of medical coverage in this country to save on eventual illness or cancers, et cetera?
Well, I think it should be. Cigarette smoking is the single most preventable cause of disease and death in this country. And we can't ignore it. As I said, $300 billion of taxpayer money is being spent annually. We have the tools and the knowledge to stop that and to curtail it while helping people who are current smokers get off the deadly habit, including in these low-income economic communities. But we're not doing it. There's a lot of, I've been in this for 40 years, and there's a lot of old thinking that's going on. It's the same old stuff. I see it on Capitol Hill all the time, the same arguments we were making in the 1990s, and we're making them today. There is no effort to have some more rational discussion now that we have FDA overseeing these things. FDA's statute that was passed over 10 years ago needs to be upgraded. I mean, they do that in with many, many other areas, and medical devices and drugs, and they haven't done it with respect to tobacco and nicotine. The environment has changed so drastically, and the technology has changed so drastically that trying to use, the current regulatory framework is like trying to put a square peg in a round hole. And Congress needs to talk about that instead of burying its head in the past, like big tobacco is the problem for all of us. It's the products we need to be providing these people and get away from the issues of who's making them. They have a responsibility under a regulatory framework to meet certain standards and requirements. I don't care who's making them. That's where we need to be headed so that the people who are addicted to these products actually have choices to make.
Well, someday I'm going to get you back, and we're going to talk also about marijuana and smoking and whether or not that's a problem, too. But, Scott, thanks for being on POTUS today.
Yeah, pleasure. Thank you.
The thrust of the conversation today, why big government criminalizing of e-cigarettes pushes more Americans into the jaws of poverty, the general theme of our conversation with Scott Ballin, who is a health policy consultant, a former chairman for the Coalition on Smoking and Health, offering his thoughts on the morning briefing.